Welcome to a Tech Moment on Cannabis Tech. I'm your host, Christina Etter. In this podcast, we take just 15 minutes or less to talk about some of the exciting innovations in technology and science in the emerging cannabis and hemp industries. Today, I am absolutely thrilled to have Patrick Vo, the CEO of BioTrackTHC, which is a Helix TCS company, here to talk about just how far technology has actually brought us in this cannabis industry. Welcome to the show, Patrick.
Thanks for having me, Christina. We're excited to be here.
Thank you. So here in Colorado, it was just a short time ago when patients still were having to go to a doctor, fill out the paperwork, wait 30 days in the mail to get their cards, and everything just moved kind of very slowly. Now, obviously, in the world of technology and cannabis in general, nothing is moving slowly these days. So let's talk about this new announcement from BioTrack, where now there's actually an opportunity for certain medical marijuana patients, I think as North Dakota is the lucky state, but are going to be able to start accessing their medical marijuana cards from their phone. Patrick?
Right. So this is something we're really excited about. So what we've done and collaborated with North Dakota is develop a system where the patients can create an online profile, submit their application digitally, track the application status, and the moment their application to be a patient in the program is approved, they can instantly download a mobile patient ID card, which from that moment is valid and ready to use. They can literally go straight into a medical cannabis dispensary from there, and they can begin purchasing. So we've removed kind of that speed to medicine, if you will. So as you mentioned, there's no longer any need to wait for a physical card to be printed, for it to be mailed to you. You can literally download it to your mobile phone as soon as it's available and walk straight into a dispensary and start purchasing medicine.
That's fantastic. So tell me a little bit about the card itself. Can this be accessed offline, or does the cannabis patient actually have to have a cellular connection to be able to connect to that card when they need it?
So the card itself, it's a digital card. It's a mobile image of the physical card that actually they will have. So at this point in time, the patient will have both a physical card that they can put in their wallet, keep in their pocket, in addition to the mobile card. But it means that they don't have to necessarily wait or have the physical card on them. The card is verified at the point of sale at the dispensary. So it needs to be paired with a valid driver's license. So you can't just take a screenshot of your mobile card and then distribute it around or anything like that, because the dispensaries will be checking to make sure that your photo ID matches the mobile patient card. But what this means is again a faster speed to medicine. So rather than at the moment you are a valid patient in the system, you can go in at the point of sale. They will look up the card. They will look up whether or not that card is in fact active, and it's a valid card. And also the same goes for law enforcement as well. So if you're a patient and you're carrying medicine on you, let's say you get pulled over at a traffic stop, and you don't happen to have the physical card on you, you can show your mobile card to the officer. The officer has a tool by which he or she can look up your card and look at the original, make sure that it is valid, a valid card, and see what your possession limits are and so forth. And so, we're very excited about this. Again, a lot of what technology is intended to do is to provide access and to simplify things and streamline things for the patients who need this medicine.
That's a really great point, Patrick, and that's the good side of technology, is when we can see it improving people's lives, making things easier and streamlining things. So people have that better access that they need. I know when I was a bud tender early in early 2016, there was a lot of frustration around some of those processes. People might be coming in with just their paperwork, you know, straight from the doctor's office, and then they wouldn't understand why we weren't allowed to work with them at that point until they actually got that physical card in the mail. And that was a significant problem for not only the patient, an inconvenience for them, but then it put the bud tender in a bad position as well. So having that quick access to the medical card absolutely makes tons of sense. And I'm excited to see that technology is kind of bridging that gap and making that window a little smaller.
And also it helps not even just for the initial card, but also moving forward as well. So for example, when you need to renew your card, rather than having to wait for a separate card to come in with an updated expiration date, again, the moment it's ready, you can download it to your phone and you're ready to go. The other thing that I did want to add is that because each patient is going to have kind of an online profile with the department, the limits, the purchase limits are tracked in real time. So before you even walk into a dispensary, and that's actually, you know, on the one of the screenshots that was sent over, it shows a kind of a green bar with what that patient's particular purchase limit is. So when a patient first walks into a dispensary, you can look up and see how much medicine can I purchase today. How much do I have left of my limit? And make sure that you don't spend time in line going through the entire process only to find out that your limit's actually not going to be available for you until day after tomorrow. So you make sure that you know exactly how much you are allowed to purchase, and you know, you can verify that with your with the bud tender as well. Also, it allows you to check and make sure that purchases that other patients have made aren't for whatever reason being applied to your card. And so it's a really useful tool, again, to make sure that you know, patients have access to the medicine, but they also have access to their own healthcare information, how much they have readily available. And finally, it's also a cost savings to the program as well. So now the program is not going to have to spend money on additional card printers, on blank card stock, on ink or anything like that. And again, reducing the overhead costs that eventually find its way and make its way to the cost of the medicine to the patient. So just all around, it's a really exciting development. We're really happy that we were able to put this together with North Dakota, and we're really hoping and looking forward to seeing additional interest from other state medical programs to deploy similar technologies.
That's great. So you kind of, you talk more about that evolution of technology, and when I first started in the industry as a bud tender back in early 2016, BioTrack was actually the first seed to sale software that I was introduced to, and it's been interesting now to kind of see the evolution of the software and the evolution of the industry, and like you mentioned, how it helps from all aspects, and how we can help the end user, we can help the dispensary keep track of things better, we can help the cultivation facilities help keep track of things better, which then in turn helps the state departments feel better because we're keeping track of things better. So tell us a little bit more, talk to us a little bit, I guess, about that evolution and how technology has played such a great role in this cannabis industry, especially through BioTrack and through the things that you've seen in recent years.
Sure. So, you know, obviously for us, one of the big components, one of the things that's most important to us is being able to provide that transparency and accountability to the industry. You know, cannabis has been unique in the sense that, you know, there was a stigma to it, you know, up until, and actually many would argue, depending on where you are, there is still a stigma to it. And so being able to provide these well-meaning, good faith, legitimate businesses the ability to, you know, to provide that comfort to the regulators and to law enforcement and to the government, saying, hey, listen, I'm a good actor. I am tracking all of my products. I'm tracking its whereabouts. I'm tracking, you know, the activity is incredibly important. But that is just kind of, that was a kind of a first level priority to make sure that there's truly a distinction between the legitimate legal supply chain and the illicit supply chain. And also to be able to provide the patients comfort and confidence of what they're purchasing and what they're consuming, that the laboratory tests that are being adhered to, to the product are valid, that it's safe for consumption and so forth. But then once we have kind of get beyond that, then the next stage is, okay, how do we further add value to the industry, to the supply chain? How do we make sure that medicine gets to the patients faster? How do we make sure that the medicine that's being produced is more effective, today than it was yesterday? So over time now, we've grown beyond just the record keeping and the seed to sale components, and now moving towards how to make sure that that software and that data is one foundational component out of the business's broader software ecosystem. So for example, it was one thing to integrate the supply chain. How do we make sure that plant data, marries well with manufacturing data, which then marries well with point of sale data? Now it's about integrating to other technologies so businesses can create that unique software ecosystem that's unique to them. So for example, now taking that data and integrating that software system with the business's accounting system, integrating it with the customer relationship management system. So, they can find ways to more directly communicate with their patients, with their consumers in adult use states, be able to identify trends and what patients are finding pairs well together, data analytics and things of that nature. So the industry is continuing to evolve, and as we kind of solve those baseline problems, and now we can start to solve additional problems and just kind of make the entire industry just run more effectively, so that way everyone, the businesses, the regulators, as well as ultimately the patients and consumers can extract as much value as they can out of a legitimate cannabis program.
Absolutely. And I can't agree more that right now, more than ever, I think data is king here in the cannabis industry. There's just so much that can be pulled from all of that data, and from understanding how customers are purchasing, how customers are consuming, and the different aspects of what the industry really is seeing in terms of that customer base. So that's absolutely fascinating. On the compliance side of things, then you also mentioned, having that capability of testing products and having the lab reports and having that assurance for the consumer that those products have been properly tested, which leads me to my next question then is, how about this new hemp industry that's starting to crop up? Does BioTrackTHC see a future with hemp industry, maybe working with the USDA, the FDA regulations, those types of things?
Sure. So the short answer is yes. A lot of what we are doing are things that have been done before in other industries. Seed to sale. Anybody who says that they invented seed to sale tracking isn't being honest, because seed to sale tracking existed in agriculture long before. A variation of it has existed in pharmaceutical manufacturing for decades. But it's taking and applying those existing things into the very unique scenario that is cannabis. Excuse me. Right. So, for example, let's just look at medical, even taking aside adult use and hemp. Medical cannabis tracking is a blend. It's a blend of agriculture tracking. It's a blend of pharmaceutical tracking with a little bit of extra craziness on top. So it's not something where you can just take a generic agriculture system that's worked for 20 years in wheat, for example, and apply it to cannabis, nor can you take a pure pharmaceutical tracking system. Hemp is honestly there are a lot of unique challenges to hemp tracking, because it is not, at least currently from a legal perspective, it is not seen as something like wheat or tomatoes or even tobacco. So our specialized knowledge and a specialized tool coming from the cannabis end makes a lot more sense for hemp tracking than the other way around. And so we're able to apply that expertise here. We already have industrial hemp farmers in New York, in Colorado. We have CBD manufacturers in Indiana and Wisconsin that are using BioTrack already to track industrial hemp, CBD products, and so forth, because of both our industry experience in cannabis tracking and our regulatory experience in cannabis tracking. So we see that as an asset. We see that as a huge opportunity to continue to provide value to help kind of that sister industry succeed as well.
Wonderful. So just to close us out, can you tell us what else is on the horizon in the future for BioTrack THC?
So one thing that we're really excited about is the fact that later this month, we will be launching our second generation software. So, BioTrack as it is right now, the foundations of which are actually still the same BioTrack that you probably remember from a few years ago. It's just, we've added more to it over time. It's interesting what we do in the sense that, I kind of mentioned before, cannabis tracking is unique from agriculture tracking and pharmaceutical tracking. It's also unique in the sense that how medical and adult use cannabis is tracked in Colorado is different than how it's tracked in Washington, and neither of those two states track it the same way as they track in New York. And so really there is a unique and separate product almost for all of these, kind of this patchwork industry so far. And so the product has evolved, it's grown, it's become relevant in multiple scenarios under multiple jurisdictions. But one of the things that we really hope to do is to say, okay, if we as BioTrack could start over and say, knowing all the things we know now and have learned collectively over the last 10 years, how would we redesign seed to sale from the ground up? So that way it captures the information that is valuable and relevant today that maybe we didn't foresee 10 years ago. How do we make sure that it is useful for not only the business owners, but ultimately for the consumers as well? We basically said, start over, clean slate. How do we build that? And we've really put our hearts and souls into putting this product together. So like I said, we're launching it later this month. We're all really excited about not only putting it out there, but really seeing how it's going to add value to the industry. And it's going to be a first iteration of second generation product. We don't have the secret sauce yet. We are still iterating it. It's still going to grow, but it's going to be kind of one more step in the evolution of how technology is going to continue to play a significant role in making sure that everyone participating in the industry, again, businesses, regulators, and then the consumers themselves, can get as much success as they can from its existence.
That's wonderful. It is just so amazing to me to see how technology, when integrated appropriately, does help things really evolve and take on this new kind of persona. And especially here in the cannabis industry, I truly feel that technology has kind of been our doorway into mainstreaming and like you said, maybe losing some of those stigmas when we can start to provide the necessary technology to show that we've kind of got it under control. So I truly appreciate your time today, Patrick. Again, thank you so much for being on the show today.
Thanks for having me, Christina. I really appreciate it.